Alright, welcome. This is Health Matters with me, Dishen Kumar, and today we are at Sanctuary here in KL to talk about something quite interesting, which is the decriminalisation of drugs, drug addiction and things like that. So joining me today is Dr Prem Shanmugam. Thank you, Doctor, for joining us today.
Thank you for having me, Dishen.
Okay, let's start off with the announcement by the Minister of Health about decriminalisation of drugs. So, what is your opinion? What was your first reaction hearing that?
Okay, now, I think my immediate reaction was that it's timely.
Okay.
It's timely that people begin to realize that addiction is a disease and it is treatable and it's not something which is a choice made by certain people. So, my immediate reaction was it's timely and it's about the right thing to do now.
Okay, now the thing is, people don't really understand.
Yes.
Because when you talk about decriminalisation, a lot of people online were asking, even on social media, oh, is it now we can do everything legally?
Yes.
You know. So, what does that decriminalisation mean, and which part of actually is it drug possession, drug trafficking, and things like that? Could you explain a bit more?
And you are right, Dishen. Now, people are confused. Quite many people in the community and out there are beginning to think, does this mean it's legal? Does this mean drug using is legal, drug consumption is legal? The answer is no, it's not. Decriminalisation basically means if you are in possession of a certain amount of drugs on you and it's for medical reasons and medical purposes, you will not be punished for it. That's what it means. Now, if we recognize addiction is a disease, then we should look at treating the disease and not punishing the disease.
Okay.
So that's the first step. I think what needs to be done now is to educate the public and educate people of the meaning of decriminalisation.
Okay.
Because there's a lot of talk now. Many associations, addiction treatment associations, communities which work with this industry are beginning to ask questions. So it's about time we start to educate the public.
Okay, I think one thing that we need to note is that the Health Minister also said that drug possession is something they want to look at, correct? A person who has a certain amount of drugs can now be charged in the Dangerous Drugs Act 1952, the death penalty. Now, talking about the death penalty, do you think it's a bit too harsh, or do you think it's something that was a decision that was made in that specific time to try to curb drug addiction at that time, and now do you think maybe it's better that they abolish it?
You see, addiction itself, the treatment of addiction itself has evolved with time. Yeah. Initially, there are various models of treatment. There's the disease model of treatment. There is a spiritual model of treatment. Then there is a social model of treatment. So with time, it has evolved. Now, initially, not many people understood that this is a disease. They thought it was a choice, right? So this is a poor choice, a bad choice. And if you make bad choices, you change the choice. If you don't change the choice, we bring in an act or law that forces you to make changes, right? And that was one of the initial reasons why the law was harsh, as a deterrent, basically. Now there was an influx of drugs coming into Southeast Asia, or Malaysia specifically. I remember there was a point of time where people were swallowing balloons in the plane with drugs, heroin, right? And keeping their stomachs full with these balloons of heroin, flying into the country and then bringing it out and then distributing it. It was getting that bad because it's a financially very viable business, in that sense.
Yeah.
Okay? So the death punishment and the law had to come into place as a form of a deterrent. But what we didn't understand then was that these people who become addicted, not the pushers, but the people who become addicted, the patients, they do not see negative consequences as a deterrent. If you're diabetic, you will not be fearful that you're going to lose your leg or lose your finger, or fall really ill. You will still continue to do things that you're not supposed to do because it's an illness. It's pretty much the same with addictions as well, which we have learned now over time. So it is probably a good idea to start to revisit the death punishment, revisit these harsh laws, and identify where specifically we should implement these kind of laws.
Okay, now from a person coming from a medical perspective, you have handled patients with drug addiction. Do you think that the start of decriminalisation, do you think that is enough, or there needs to be other steps as well to take in order to give a much more wholesome effect on the whole drug addiction problem in Malaysia?
Okay, I think there are many steps that we need to take.
Okay.
The first key thing is education. Now, are we ready? Is the public, is the community ready to accept this change? It's a huge change. It's a huge change. So now you're saying I can carry certain amount of, say, cannabis in my pocket and I can walk around, right? So how much is accepted, how much is not accepted?
No, but you still get charged. You don't get criminalized for it, but you still get charged for having
Yeah, but if it's for medical purposes? See, like for example, I said, there are various types of drugs. Marijuana, there is medical reasons why marijuana can be used with a prescription from the doctor, which Malaysia has not gone into yet. And now with this decriminalisation act, that's the next thing that may happen, you see. People may start to keep it for medical reasons. But the other people, the community itself at large, the public, need to understand and be educated. Because this will cause confusion in other people. And it also cause confusion with the teenage, the younger community, the adolescents. That's a growing population which is becoming addicted now. More so with the influx of synthetic drugs, right? There are lots of synthetic drugs coming into the market. They are known as NPS, new psychoactive substances.
Okay.
This is another, what do you call, influx of drugs that's coming into the market now. Very difficult to be detected. They can't detect it in the urine or in the blood. You know, it's very difficult, and the teenagers are abusing it. So lots of education needs to come into play. What is legal? What is illegal? How much can I take? How much can I not take? And who decides this? That's the first thing. Now the next step is treatment.
Okay.
We have been treating addictions for years and years and years, and we still have not found the right recipe. We've got lots of new technology, lots of research. Lots of research are being done in local universities. Lots of research are being done in foreign universities. But where is this research, the findings of research being implemented? I'm involved with some studies here and there. My question is, we find, how do we implement? Now, if we want to implement, who are the experts who can implement these things? So I think the ministry needs to work closely, the government needs to work closely with private sectors. We are involved directly with treating people, and we bring in Western technology. Now, Western technology works for the West.
True.
What guarantee is that it will work for us? So we need to customize it. We need to culturalize it to the local population's needs. So first is education, second is treatment. There's lots of work we need to do.
Okay, talking about that, I love the fact that you use examples like medical marijuana and things like that. Now, in other countries, there is this change in law where people, governments are looking at the law, medical marijuana and things like that. They're kind of legalizing it. But I'm not saying that we should do that in Malaysia. I'm just saying that should there be a conversation in where actual drugs like marijuana, like morphine, who actually help patients. There are case studies on things like this, helping patients handle their problems, handle their illnesses and things like that. Do you think that there can be a certain amount of conversation saying that maybe, not now, not in the future, but maybe we can start a conversation saying that it's okay for people who have severe illnesses to use this type of drugs, and it can be actually regulated by the government?
My immediate response to that would be yes. It's about time we start to review our policies and look at the possibilities of accepting instead of continuously just pushing people and challenging them. Now, an example would be Daun Ketum, right? They have found quite a lot of medical purposes that it serves, but it is addictive as well. If it's cocktailed with other kinds of drugs, it can be addictive.
So where do we actually draw the line? Because you want to bring in, say, things like Daun Ketum, marijuana, morphine and things like that. There is a chance for them to get addicted to it.
Yes.
So how does the government try to look at it and say, just giving your opinion on it, how can they regulate that in that sense?
Oh, that's a lot of work. We need to work with each other actually. There's not one particular specialist in this area. So we need, for example, now the Ministry of Health is working with this, brought up this thing about decriminalisation. The police have to come with enforcement. The agency, Anti-Drug Agency of Malaysia, narcotics people and the Anti-Drug Agency, they have to come together and sit down, which they are doing, mind you. We have already been talking and discussing a lot about this. And I know this because I'm involved sometimes as well.
Okay.
They actually bring in industrial experts and they ask our opinion, so we are talking a lot about this. We need to do, see, in order for change to happen, we need to do different things.
Okay.
If we keep doing the same thing over and over and again, expect different results, it's not going to work.
Yeah.
So I believe this, what we are doing now in the country is we are beginning to look at it differently. So do we need to look at medical marijuana? Do we need to start thinking about prescription for drugs? I think yes. Because we have been trying to punish and we've been trying to use the law to deter. It's not worked.
Okay.
And research does show us that they do serve a purpose anyway. Portugal has decriminalized addictions, drugs, and crime rate has dropped. People seem to be happier there. Overdose from deaths have dropped drastically.